Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. We had a question from a young gentleman on fat lipoma, I guess, fat all over his body.
Yes.
What are they? They're tumors, huh?
They are tumors.
Yeah.
They are subcutaneous tumors. They can be multiple, and of course, no etiology is known, like no reason. But inheritance must be playing role in it. So lipoma is basically collection of fat tissue. It is encapsulated and in subcutaneous space. So it goes on growing. Really, it is clinically a very harmless growth. Harmless growth, and body somehow under some delusion, body goes on maintaining it. And I have seen lipoma growing in huge size, even up to the extent of 3 inches, 4 inches in dimensions.
But it is unsightly.
Yes, but beyond disfigurement, it doesn't cause any issue. Lipoma in general is harmless in the sense it doesn't cause pain or discomfort, or it doesn't complicate into anything. And that's why surgeons never encourage resection or removal of it unless it is at pressure point. Suppose the lipoma happens to be on a pressure point when person is lying in bed and it's getting pressure,
Yes.
then it can become sort of a discomfort for the patient. So there they remove. But we have noticed that if you try to remove one lipoma, then the remaining lipoma grow gallopingly, or even so many, like it multiplies.
We have seen this in other things also.
Yes. So one should avoid intervening it with surgery, but homeopathy has remedies where those remedies can control the growth. They can contain the growth. At the same time, even that multiplication.
Can they reduce
So,
it?
so if we, of course, we have cases where they have regressed to some extent, but we don't see, say, they are completely eradicated or removed. With sonography, we can make out a differential diagnosis can be done. Sometimes we get confused if it is on a bony prominence. Sometimes we have seen that seemingly it was a lipoma, but it turned out to be dermoid cyst. But with sonography we can diagnose it better, because the dermoid cyst has a stalk which is connected to the underlying bone or underlying tissues. Unlike lipoma is absolutely an encapsulated fat
on the skin.
Below the skin.
Below
it
the
is
skin.
subcutaneous.
Subcutaneous.
It is below the skin. It is
But
always
not on the bone.
not on the bone. Lipoma is always in a subcutaneous space, but as it occupies space, it gives tension to the skin and it looks quite elevated. I have seen in some severe cases where they have dozens of lipoma on upper limbs, on back, on abdomen. Many times we have seen that if they are on the renal angle or back, it causes discomfort because person can't lie down with the whole weight on it. Therefore, otherwise lipoma is not something which one should react. One should, for whole life, I don't think lipoma will affect the quality of life also. So better not interfere with it. But as a homeopath, we take it as one of the component of the totality. If we have treated people with lipoma, but not exclusively for lipoma as a primary complaint. If the person has some other joint pain or something, and along with that, if lipoma is one of the component of totality, we treat the person, and we have seen the progress of the lipoma also is controlled.
But I would imagine that if it is on the hands or face.
Face, it is rare. It doesn't
rare.
come on face. But commonest
But on
is
the arms?
yes, arms, forearms, even legs, thighs, trunk. They are very common. Even a neck you get.
So you have never seen it disappear?
We have cases
Oh, you
where,
have?
they are in a primitive size, so small, and then it is like imperceptible, even on clinical examination. But that happens when we have treated it in a very, what we call a smaller size, like say 1 centimeter size. Otherwise, we don't follow it also. We don't pursue, we don't encourage person to go for treatment of lipoma. It is not worth following it for 5 years, if at all it is amenable to homeopathy. Yes, if it is gross size, it is disfigurement which bothers.
Exactly.
Otherwise, I don't think lipoma should bother anyone.
Okay. Thank you.